Spondyloarthritis is a group of inflammatory rheumatic diseases that can cause arthritis and affects mainly the spine. It includes a number of related conditions, such as ankylosing spondylitis, reactive arthritis, psoriatic arthritis, and others. Ankylosing spondylitis, AS, is the most common type of spondyloarthritis. It is a chronic inflammatory disease that affects the joints and ligaments of the spine and can cause stiffness, pain, and eventually fusion of the spine. It usually starts in the late teens or early 20s and affects men 2 to 3 times more often than women. The cause of AS is not yet fully understood, but genetics and environmental factors are believed to play a role. The symptoms of spondyloarthritis can vary depending on the type of disease and the individual. Common symptoms include pain, stiffness, and swelling in the joints, particularly in the spine. Other symptoms may include fatigue, eye inflammation, skin and nail changes, and gastrointestinal problems. In some cases, spondyloarthritis can cause complications such as osteoporosis, heart disease, and lung problems. Diagnosis of spondyloarthritis involves a combination of medical history, physical examination, and imaging and laboratory tests. The diagnosis may be challenging, particularly in the early stages of the disease. Imaging tests such as X-rays, MRI, or CT scans can help to detect changes in the joints or spine. Blood tests can also help to identify markers of inflammation or the presence of the HLA-B27 gene, which is associated with an increased risk of developing spondyloarthritis. Treatment of spondyloarthritis aims to reduce symptoms, prevent joint damage, and improve quality of life. Treatment options may include medication, physical therapy, and surgery. Non-steroidal anti-inflammatory drugs, NSAIDs, are often used as a first-line treatment to relieve pain and inflammation. Disease-modifying antirheumatic drugs, DMARDs, such as methotrexate, sulfasalazine, and leflunomide may be prescribed to slow or prevent joint damage. Biologic drugs, such as TNF-alpha inhibitors or IL-17 inhibitors, may be used in cases where other treatments have been ineffective. In some cases, surgical treatment such as joint replacement may be necessary. In addition to medical treatment, lifestyle changes such as regular exercise, weight management, and stress reduction may help to improve symptoms and overall health. It is important for people with spondyloarthritis to work closely with their healthcare team to manage their condition and to discuss any concerns or questions they may have about their treatment. In conclusion, spondyloarthritis is a group of inflammatory rheumatic diseases that primarily affect the spine but can also involve other joints and systems in the body. The most common type, ankylosing spondylitis, is characterized by chronic inflammation and eventual fusion of the spinal joints. Spondyloarthritis can have a significant impact on an individual's physical and emotional well-being, but with proper diagnosis and treatment, many patients are able to lead productive lives.